Welcome back to Territory Health. In this video, we'll look at a common condition that many people suffer with in varying degrees. Research was carried out on a group of individuals before 2020 to analyse the effectiveness of exercise on the lumbar region or the lower back and the prevention of pain in this area. It was determined from the study that exercise on its own and exercise with education was able to prevent the reoccurrence of lower back pain by up to 33%. Lower back pain was much lower in people who rarely exercise. The report went on to say that pregnant women had suffered less with low back pain during their pregnancy due to exercise. In short, corrective exercise for your back first helps reduce the risk of lower back pain and also helps prevent its reoccurrence. Whilst most people who suffer back pain will recover after a short period of time, the intervention of exercise or regular exercise program is crucial for strengthening those weak areas of the back. This helps prevent the reoccurrence of those old annoying pains, promoting better posture for your back. After all, the back muscles can be viewed as the muscles of youth, which holds us upright, preventing us from leaning or being bent over forward towards the floor. It's not uncommon to find some people, for varying reasons, start to be bent over towards the ground as they age. A reminder that the forces of life are pulling us towards the earth from which we came. It's clear that if you are suffering from chronic back pain, the first recommendation would be to consult a doctor or specialist who will be able to give you some more information, insight, recommendations and treatment regarding your condition. If the pain is coming from the spine, it most certainly will need to be investigated by a medical practitioner. For those not suffering with such severity, back pain is often a muscular issue, and performing exercises targeting those muscles will go a long way to improving your back, your overall health and your posture. It is recommended that you start off with bodyweight exercises before progressing slowly towards other form of weight-bearing exercise or to provide and maintain a progressive overload. The following muscles will be the ones that you will need to focus on to get the most out of your workouts and the most benefit for your back. Number 1. The trapezius muscle, otherwise known as the traps. This muscle extends from the external projection of the occipital bone to the lower thoracic vertebrae and laterally to the spine of the scapula. It plays a crucial role in facilitating various movements of the head and neck, including flexion and extension, moving your head up and down, rotation and lateral motion. These functions enable the body to maintain proper posture and engage in various activities. Number 2. The latissimus dorsi, or the lats. The latissimus dorsi stands as the back's broadest muscle, significantly contributing to the shoulder's extension strength. The muscle starts at the lower 7th thoracic vertebrae, the inferior angle of the scapula, the thoracolumbar fascia and the iliac crest. The muscle inserts onto the upper humerus or the arm bone between the shoulder and the elbow joint. It is difficult to isolate this muscle, although its center is more accessible for examination by touch. This muscle is key in enabling the shoulder to extend, move closer to the body's midline and rotate internally. Number 3. The core. The core muscles, which consist of the rectus abdominis, the internal and external obliques, the thoracolumbar fascia and several other important muscles, sit within the center of the torso and are essential for maintaining stability and aiding biomechanical functions of the body, which includes extension, lateral flexion of the spine and rotation. Number 4. The rectus spinae group. The rectus spinae are a group of muscles made up of 3 segments: the spinalis, the longissimus and the iliocostalis, stretching from the lower back at the sacrum all the way up to the skull's base. Each segment has a distinct role, with the spinalis being the most slender and positioned nearest to the spine in a laminar groove, while the longissimus and iliocostalis, which are more robust, create a noticeable bulge next to the spine's lumbar and thoracic regions. These muscles play a crucial part in arching the back and bending the torso to the sides. Number 5. The gluteals. The gluteals, which are otherwise known as the buttocks, consist of 3 muscles: the gluteus maximus, the gluteus medius, and the gluteus minimus. The huge gluteus maximus is the most prominent and visible of the three muscles, which lies to the posterior. The gluteus medius is located on the lateral side of the hip, and the gluteus minimus lies deep under the medius muscle. All three powerful muscles help to perform extension, abduction, and rotation of the hip. Using a high repetition range will help you to overcome muscle weakness in these areas, and over time this can be adapted as strength increases with a gradual weight overload to stimulate muscle growth. I hope to cover some exercises for each of the muscles mentioned in future videos, but for now, if you have enjoyed this content, like this video, share, subscribe and leave a comment below, and look out for our next video. You can also check out our previous video by clicking on the video suggested on the screen. Thanks for watching Territory Health. Be healthy and God bless.